Good morning. Hello, everyone. My name is Sarah Lavonne, and welcome back to my YouTube channel. I am here live for this coffee and questions. And so today, if you haven't joined me for a coffee and questions, I actually kind of like them more live. I feel like they're more interactive. I already see you guys going crazy in the chat box, and I love it. So the premise of coffee and questions is really that I have the opportunity to connect with you and answer your questions, likely from previous videos or also things that I just haven't addressed before. So some of those things today, I already looked through your questions. There's a lot of high risk questions today. I don't know what's going on, but like lots of little complications of pregnancy that people have questions about. I am an RN, so I will answer those. But before I do that, make sure you subscribe down below, give it a like, share it with a friend, the normal spiel. Now, as I'm waiting for you all to log on, it is morning here in LA, so excuse my voice. I'm going to keep drinking my coffee as I wake up. I want to hear in the chat box, if you are here live, let me know your questions that you want me to address. I will prioritize those of you that have taken time out of your schedule to be here. I also pulled questions from previous videos. The one that I went to was the last coffee and questions. You guys had a ton of great questions in that one. And then I also threw out a poll on Instagram. So we have lots of places that we can pull questions from. While I'm waiting, I want to let you know about Ana Luisa. If you have not heard me share about Ana Luisa, you have to know these pieces, all three pieces that I'm wearing today, are a part of their new line that I was so excited about when they sent it to me to like choose my new like jewelry set to show you guys. I about died because I've been totally into the subtle bling. And this one, I will post a picture on my Instagram, the Sarah Lavonne Instagram, and you can look. But it has these little, I hope you can see this, these little like pokey triangle square things with the rhinestones. And then these earrings I'll show you really quickly while we're waiting. So these earrings are like a geometric, cute little dainty hoop thingy majiggy. What I love about Ana Luisa is that they're not only sustainable, which I am looking for these days, that has become a priority to me in my life, but also they're super affordable. I actually, newsflash, I took off some bracelets that I was wearing last night in like a stack on this wrist, and I pulled them off and my arm was green this morning and I had to like scrub my arm. And so this is where like you can buy the really cheap jewelry, but what I find is that you wear it once, it gets wet, and then you can't wear it ever again. So you spend a smidgen more. We're not talking crazy prices because they pride themselves on being affordable, but they also, they don't turn your arms green. And so that's not only important, but it's also like, then they'll last forever. So I got this super cute little set. It has like little sparkly rhinestones, my little earrings, my necklace here. If you want to know more about them, you can check out the description box down below. I left everything there. I see your questions coming. Don't you even worry. I'm just letting you fill the chat box so I can grab your questions in a second. How many of you have had Ana Luisa jewelry in the past? I have shared about them on previous coffee and questions. I've talked about them on my Instagram. Really anywhere, and I wear their stuff all the time. Last night I had this little green necklace that I wear all the time on, and multiple people were like, oh my gosh, look at your necklace, where'd you get that from? I'm like, Ana Luisa, of course. So anyway, you can check them out in the description box down below, and there is a promo code down there for them. With that, let's get started on your questions. So I'm going to scroll back. Excuse me as I roam around. I'm at my standing desk. Actually, as you're adding your questions, I saw a very great opener question on Instagram. This is from Gina Sozio. She says, how are you? Life updates. It's been a minute. So again, as you're adding your questions, quick life update for me. There's been a lot going on. I don't know if you can tell based on YouTube. Normally, I post once a week. I've done that for like 4 years. And what I found is that really, for the sake of life and mental health, for my own balance in my life, for lack of a better word, I have been trying to give myself grace and maybe not put so much pressure on myself to give you a video that much. There is so much content on this channel, most of which is still very relevant, even the stuff that's on the older side. And so I've been sort of trying to work on my own personal boundaries of loosening up on the goals that I have set. With that, I have lost my editor. So I want to create a public shout out / also a public request that my editor of like 3.5 years, Brian Lemons, he has saved me in so many moments of this business growing and being amazing, and sort of come through in the times when like I've been so overwhelmed. He showed up at the perfect timing. He has been such an incredible blessing. He has moved on to a whole nother situation. And so I am in search of a editor. So if you know of anybody that wants some extra work, it could be remote. Ideally it's in LA, but flex and flow, let me know. The other big change in my life is I became a plant mom. If you've been following my personal Instagram, I got like 32 plants in the span of a weekend. It's a little out of control. When I go big, I go big. So I have a couple. This one's actually fake, but it's just there for staging because I was not about to lug the trees that I have in my apartment over here. But 2 of my little babies are here. So I actually have a hobby. And the reason for that is I have not had a hobby in like 4.5 years until I hired a full-time chief operating officer. His name is Brian Cole. I know from childhood, he's sitting right here, and I'm going to make him give you a cameo so you can meet him really quickly. I promise you I will answer your questions. Come in here for a second. This is Brian.
Hi.
Brian, I actually know from my childhood. So if you go to my personal Instagram, there's like photos of us at piano recitals from forever ago. He's very tall, so you have to like lean over. So I'm short. Look at it. They say hi. How cute. So this is my lifesaver right here, everyone. You will see me more. You will experience more creative. I have like a whole childbirth program coming in my head. And the only reason for that is this. She asks, are we together? Can we let the secret out?
Not the only one to ask.
Everybody thinks we're together. I call him, can I say it?
Sure.
My gay work husband. He is engaged and not into me, which is totally fine. And actually works very well for our work dynamic, and it becomes less of an HR nightmare. So
less work for me.
Yeah, less work. Yeah. But we work very well together. We've learned that. It was a little bit of like a random, let's see how this goes. And sure enough, it like could not be going better in my mind. And he's joined the BUNDLEBIRTH family. So we have a man in the background. He was like, how am I going to work on birth? And I was like, oh, we'll figure it out. You're not doing birth. That's my job. Let me do my job. You do all the business stuff. So that's what he's here for.
Oh.
So thank you.
Thank you. And thanks for the congratulations. Y'all are sweet.
Why am I so pretty? It's all my skincare. Just kidding. You're so cute. I love you guys. Okay, let me go back to your questions. Let's get at it. All right. LP, I see you. She's 39 and 4. In her second pregnancy, she had a placenta previa with a scheduled C-section, praying for a Vbac this time, still no signs of labor. Okay, so she said she's like a new mom, having never gone through labor before. Any advice for getting myself through the week? How many of you are here with LP, whether you're a Vbac, TOLAC, you've had a C-section, you've had a baby or not? You are right in that perfect little time frame where every day, every hour feels like your whole life, and it can feel really, really long and exhausting and hopeless. Here's where, and actually the reason why I said this before, I was like, I'll address this because I have a client that I just listened to a podcast she did on the Informed Pregnancy podcast. If you haven't heard of the Informed Pregnancy podcast, it's done by Dr. Berlin. He's a prenatal chiropractor here in LA. I am good friends with him and his family. I use his wife. His wife's a perinatal psychologist. I send clients to her. She partners with my VIP program. I'm seeing her on Thursday. They are amazing. I've actually been on the podcast as well, talking about childbirth education. And so one of my clients, Michelle Musto, she was just on the podcast and shared her first story of what ended up being a C-section with her Vbac. So I gave you like a little bit of a teaser, but she told the story and I got to be there for the second. And so I think part of this, what reminded me of it was the frustration at the end. And then I also saw somebody asking about an induction for a Vbac. And this is where, like, depending on your provider, Vbacs can be induced. And just because you're being induced does not mean it's not going to go well. All right. This goes for anybody, whether you are waiting for labor and they're talking induction, or you're a Vbac, meaning you've had a C-section in the past and you're waiting for that vaginal birth or to go into labor. I know most of you, a lot of you likely, just by my experience, would want to go into labor naturally on your own, labor at home, and do all of that fun labory stuff. So I get it. Now, sometimes an induction is an appropriate response. Sometimes it's your choice. Flex and flow, totally up to you. Okay. So as you are waiting and as you are hoping for labor, I saw that she's bouncing on her labor ball, do all the things. This goes back to, and you're going to be like, oh, Sarah, you say this so much. It's because it's for real. And I use it so much because it actually is the truth, that we pick up what we can control and then we let go of the rest. And what can you control? Watch my Engage the Baby video, be walking, be eating healthy nutrition, really prioritizing your rest, working at getting the baby into the pelvis, softening out any kind of tension anywhere, stretching, doing some squats. And by squats, I mean like literally going down. I don't know if you can see this, into a squat. I hope you can hear me. Can you hear me? Into a squat position, put something under your butt. You're not like doing squats for like strengthening your legs, okay? That's not the point. The point is relaxation and softening. But when you go down, what you're doing is opening up your hips and really stretching into that space. So hang in there. Take it one day at a time, one moment at a time. You literally could have your water break right now in this moment, which would be like really an epic story. So if it happens to any of you, please let me know. Because really, truly, there's nothing to be afraid about. Induction, I have seen very, very successful, Vbac or not. Obviously, it still needs to be your choice. And then take a deep breath and just relax. And then the goal is, once you've picked up everything, by letting go of the rest, I really mean working at that relaxation, working at that softening, like really working to relax, because the more tension you hold in your body, the more adrenaline, the more fear, the more, I gotta get into labor. All those hormones actually they counteract your labor hormones. Okay. So the best thing you can do is just let it go. It's all good. All right. All right. Aw. LP, you're so sweet. All right. Will labor be fast if I had a C-section because it's my second, or no, because I never made it to pushing? Last check before C-section due to my heart and baby's heart rate was 5 centimeters minus 1 station, 50% at 32 hours. Okay. If you have not had a vaginal birth in the past, you can expect that your labor follow the course as if it's your first vaginal birth. Now, here's where there's a smidgen of a caveat. Everybody's different. There's so many components that are like falling into place when you're in labor, okay? So I can't promise you anything. I never promise anything. That's why flex and flow. But what I will say is that those of you that maybe made it to pushing, that sometimes, in my experience, I just had this happen, that going through the labor process and getting to that pushing stage can be a smidgen faster and look more like a second mom because the cervix has actually dilated. But if you haven't gotten there, I would expect, just for setting clear expectations where you're not disappointed, to expect it to go like a first labor. Cute. Okay, losing weight. How many of you are worried about your weight? How many of you are being told to be worried about your weight? All right, Joyetta, thanks for everything you do, Sarah. Coughing questions about BMI of 29 and pregnancy. I keep getting told that I need to lose weight prior to getting pregnant. Okay, so here's the deal. Being healthy prior to getting pregnant is the best thing, okay? Being healthy meaning being of a normal BMI. BMI is like, that's a whole nother, like the history of BMI and how we came about BMI and how there's different like ways that like some people carry weight differently, and like, so again, whole nother YouTube video. But ideally, yes, that you are in a fit state, that you are exercising, that you are eating healthy, that your BMI is not above normal, ideally. Do people get pregnant all the time without their BMI being within normal range? Absolutely. Is it better for your pregnancy? Yes, because an elevated BMI, body mass index, so being overweight or obese, in pregnancy does predispose you to a few medical complications in your pregnancy. You have less of a chance of complications of your pregnancy if you have a normal BMI, okay? Just because you have a normal BMI doesn't mean you're not going to have gestational diabetes or preeclampsia. Those are the two big ones that we talk about a lot. But so the recommendation would be yes. And it's just good for us, right? I'm actually on this health journey right now too, where I have not prioritized my health. I did for like the egg freezing stunt. If you haven't seen my egg freezing vlogs, those are really interesting. But also I've had like a wild and crazy work year and 4 years of my life, and being an entrepreneur has been taking a toll on my stress levels. And so I too am kind of joining you on this and prioritizing my health and saying like, I'm working on some body image issues and stuff. And so is that work important? I think so. And I'm going to encourage all of us to do that. And can it prevent you from getting pregnant? Yes. Being particularly obese or even into the morbid obesity category, that does predispose you for having a harder time getting pregnant. Can you still get pregnant? Yes. But does it set you up for a more challenging pregnancy? Probably. So that was like sort of my roundabout answer to saying like, yes, but like, flex and flow. All right. Cute. Hi, Miriam from the UK. Kinsey, Sarah, can you address tailbone or rectal pain in labor? Yes. I love this. I don't love this for you, but I love talking about this stuff. Okay, that was the only area I experienced pain, and it became so excruciating. I felt like I was being stabbed and like it was going to explode. Oh, honey, that is a lot. I was being induced. It led to an epidural and then to a C-section because I didn't get past 6 of dilation. Thoughts, coping suggestions. I'm going for an unmedicated Vbac. So this time. Okay, so Kinsey, I recommend you going straight over and grabbing my coping with labor class because that is number 1. I'm going to grab my pelvis. So when we look at the tailbone here, all right, at the back. So this is me this way, okay? This is my sacrum. So everyone find your sacrum, go into your like butt crack, okay? I got some booty here, so like you got to really push and find down towards your butthole where you'll find the tailbone, okay? This tailbone in here is obviously, this is where the baby comes through eventually. So as baby is coming down, right, all of these bones in the cartilage have to move a little, right? And as they move and wiggle, they pull, and as the baby comes down, they pull on the ligaments, the fascia, and the pelvic floor. One more pelvis, okay? So we got all the pelvises in this house. Let me tell you, I am just a pelvis woman over here. Okay, so in your pelvis, there's the pelvic floor as well. This is your vagina. Around the vagina, there are muscles around the vagina. So if you squeeze your vagina right now and just squeeze it up, that's considered a Kegel. Loosely, that's probably not the best Kegel in the world, but you get the idea. Now, that's the external. Like if you squeeze your butthole, squeeze your vagina, there's some of that, okay? But inside, there is a pelvic floor on the inside, and those muscles, the baby is going to stretch as they come down. So I'll take it out so you can see that inside the baby has to come through here, right? So it really has to stretch like the size of my fist, okay? Now, if this is super tight, that can prevent the baby from coming down. Now, look at what it touches. This is your tailbone, okay? So as the baby's coming down, if there's tension in the pelvic floor, if there's tension in the ligaments, fascia, there's scar tissue, there's history of trauma, there's surgeries down there, that can prevent you from dilating. And also, as it pulls, it likely is going to cause some tailbone pain. So my biggest recommendation for you is movement, motility, stretching, and then seeing a pelvic floor therapist for your next birth, especially if you're wanting a Vbac and you want to go unmeditated. You should go meditated, okay? Go meditated, but go unmedicated. First of all, take my coping with labor class and then get yourself a pelvic floor therapist so they can be working in there to really soften out. Chiropractic can also be very, very helpful, but there's also stretches. I can do a YouTube video on that if you want for some like tailbone, pelvic floor type stretches. If you want it, let me know. And for all of you, that's one of the ways that you can be preparing your body for labor. I love pelvic floor therapy. I think it is like one of the most underrated things here in the United States that everybody should have someone on 13. That's what I got. All right. Let's see. Is this common? Okay, did something I do wrong? Okay, Emily Johnson, I see your breastfeeding question. All right, breastfeeding question. First time mom, my baby is 3 months old. I never produce more than maybe 3 ounces of milk a day. I was so sad because my baby latched so well. I tried all the things and it just never got better. Is this common? Is it a first baby thing? Did I do something wrong? You did not do something wrong. Take a big deep breath, let it all go. Breastfeeding is challenging, all right? And a lot of times I feel like there's too many cooks in the kitchen. There's too much information out there with something that is sort of the same as labor in terms of like labor's not the same. So for me to give one person an answer about what happened with their labor is likely going to be different than somebody that had something similar. There's a lot going on, all right? My question for you, and this is where like I can't totally answer this question because how do you know it was 3 ounces of milk a day? If you were feeding and then pumping and the leftover milk was 3 ounces a day, that's incredible. That's great. Or is it that you were feeding or you were only pumping and that's how much you got and you fed with a bottle? Or, I know this is getting complicated, or something else. So because to expect to have more milk on top of a feed is sort of like a bonus. It's nothing. At some point, your body regulates, and you shouldn't really have that much excess milk unless you're trying to have excess milk, because your body takes about a month, 4 weeks to figure out how much your baby needs. And then it's like, oh, I don't need any more than that. Why would I make any more? Unless you tell it to make more. So again, I have so many questions for you, but I would just say, this is not uncommon. You are not alone in that. It is not necessarily a first baby thing, but especially for those of you who are preparing to breastfeed, if that is important to you, couple of things. You need a breastfeeding team, just like you need a team for labor. If it's important to you, you need friends that are breastfeeding, that, find your little support groups. There's lots of people online that like do that kind of thing. And then who are your lactation specialists to help you guide? Because so much of this is kind of like labor. Labor's like so natural and you just go with the flow. Yet there's so much going on, especially if you give birth in the hospital. There's so many questions that can come up, different complications. What do I do here? These are big deal type things. Rule of thumb for breastfeeding is you want wet diapers and you want baby gaining weight. If they're not getting their wet diapers and baby's not gaining weight, then you probably don't have enough, or that there's a supply issue there. Okay. But that's very complicated. Wow. I see so many questions. Okay. Whoa. Let me go back and find, are you guys together? That's what I see right now. Okay. I'm like not even going to get to the phone ones. Y'all that are here, I'm like, thanks for being here. Let's answer yours. Okay. Tailbone pain. Elisa Ernst said, this is my second child. I'm 37 weeks. I lost some of my water and mucus plug this morning. She's going to have a baby. I wasn't due until the 25th of this month. What's the risk of infection if I labor at home and wait? So, Elisa, I'm going to tell you, call your provider and go, hey, this is what happened. I'd like to labor at home as long as possible. And they're going to recommend to you a time frame. In general, once your water breaks, ideally for the risk of infection, an infection for you, infection for the baby, potential leading to complications, we want you to have your baby within 24 hours. Now, does that mean you're on the clock? No, it should not. I'm not your provider. I'm not making those decisions, right? But in general, the answer is it should not put you on the clock. So long as baby looks good, there's no signs of distress, that everything is progressing normally, in theory, you wait as long as you want. Now, here's the deal. If you don't start having contractions on your own within about 6 hours, the chance of you continuing to have contractions is pretty low. So that's where, once you hit that 6 hour mark, that's usually where providers are like, you can wait for 6 hours. And then if things aren't progressing, by progressing, I mean you're having contractions that are getting stronger and closer together, then you probably should go in just to be monitored. Make sure baby's okay. Make sure that you don't have any of those infection risks. Now, there are places in the world, especially like, let's say you're having a home birth or you're delivering at a birth center. There are other ways of practicing, right? I'm used to the hospital system. That's what the hospital people are going to tell you. And that's where they're coming from. So this is, again, where you're calling your provider and going, what should I do? Moral of the story is that you're 37 weeks, so your baby is formed. Once you hit 37 weeks, especially if you go into labor on your own, that in theory means that the baby's lungs are ready, all is well, you should not have any concerns necessarily. That's not an automatic admission to the NICU for being premature, the neonatal intensive care unit. You are good. So please don't stress about it being earlier than your due date. This happens. And you don't have to wait like the rest of you pregnant people that are like desperate for labor to start. Okay. Okay, this is great. Welcome to the club, Brian. You guys are so nice. I love you all so much. Okay, my first delivery was spontaneous labor at 40 weeks and 1 day. She's currently 40 weeks and 3 days with my second and no signs of labor. I'm nervous about induction. How many of you, this is so common. If you are early pregnancy and you're like, oh, what? Pay attention to this question because this happens all the time, right? This is like what I see with my clientele all the time as well. So I'm nervous about induction. How often does your second labor require induction after a spontaneous first? You eventually will go into labor. You will. You're not going to be pregnant forever. It's very rare to hit 42 weeks. Does it happen? Yeah. But you're going to go into labor. I have lots of faith in that. Again, no problem. I don't ever promise anything. I would say, so this is not uncommon. It's a bummer. Once you hit 41 weeks, they will talk to you about induction. And there is some pretty good data that shows that there's really less risk to being induced than it would be for you to go into labor spontaneously after 41 weeks. But this is where your experience, your preferences, your intuition matter so much here. So think about how you feel about it. And then this is where too, kind of goes back to that original of like, we're picking up what we can control and stretching it out. There's probably an engagement issue because once baby sits on the cervix and they come down into the pelvis, not like floating around up here, but like zoom into the pelvis, that likely is what triggers labor. So there might need to be some rotation. So a lot of like curb walking, stretching, sideline releases. You can Google that. And then kind of moving like big hip circles on a ball, all those kind of movements to kind of just help baby like, and then hopefully they'll go into labor. Let us know how it goes. Please follow up. That would be so fun. Okay. Would you recommend against having another baby if you had cholestasis with your previous pregnancy? No, not at all. Have as many babies as you want. Just because you had cholestasis with the first does not mean it's going to happen again. And even if you did, most of the time, again, this is where I'm very sensitive to even saying this because it can be catastrophic for some, but most of the time you're induced at 37 weeks and that is it. No big deal. Please don't stress. LP, can you say the name of the podcast again? Yes, thank you for reminding me that we have a podcast. Now, this podcast is specifically for labor and delivery nurses. It is with me and Justine, who's director of labor of nursing. And but I will say that I was listening to listening to the edit on one of them. And I was like, this is really good for patients too. And for you all to know sort of the world that you're walking into, what the hospital is like. I get a lot of DMs about people that are like, I kind of want to be a nurse. I kind of want to be a doula. What's it like? What do I have to consider, etc. And so sort of like the insider scoop on a lot of that, what the research says, what the new trends are in birth. We just did one about birth plans. So you can kind of hear the perspective of a labor and delivery nurse for you there. So it is called Happy Hour with BUNDLEBIRTH Nurses. And I'm going to have Bri link it in the chat box. He's like paused right now, freaking out. If you go to my YouTube channel, find this video, go into the chat. The URL, or somebody else can put it too, is just www.happyhourwithbundlebirthnurses. It's long, but then you can find it all there or go on all your podcast things. So thank you for reminding me that we did that. My baby is frank breech. Does that affect my body going into labor? It can, yes. For that same reason, for engagement of the baby, that if baby doesn't kind of nuzzle its way down, that can prevent you from going into labor. LP, she's like, I hope, even if I haven't lost the mucus plug yet. So I'm guessing that like you could go into labor at any point even if you haven't lost your mucus plug, listen to me loud and clear. Everybody that's so stressed about their mucus plugs, I hear this constantly. Your mucus plug does not matter, okay? Contrary to popular opinion and the number of like questions, and the whole reason why I have a YouTube channel and I continued was because my mucus plug video did so well, okay? So your mucus plug, you may see, you may not see, it's there in there somewhere. If you lose it, you lose it. If you don't, you don't. If you lose it, it could mean labor right now. If you lose it, it could mean labor 2 weeks from now or anything in between. It literally does not matter, okay? Let it all go. Oh, Jenny, I love these. And I love how you all encourage each other. Sorry for all my notifications. That now do not disturb is on. All right. I had a planned C-section with placenta previa with my first and an induced Vbac with my second. You got it, mama. See, it happens all the time. And you guys are going back and forth. I love seeing that. I was told I can't labor in birth run, I don't know what birth run is, or have a water birth if I have a high BMI. That's going to be facility specific. Okay. And like whether or not you have a high BMI, that really, it may make monitoring more challenging, but from my perspective and my experience, I would say that your care team should be able to try and accommodate you. And it's their job to go out of their way to help accommodate your preferences in a safe way. So not everybody can even have a water birth in general. That's like pretty uncommon in the hospital setting. If you're at a birth center, that's a different story, but most of the time people aren't delivering in the water in the hospital. Okay, cute. Annie, thank you. Subchorionic hemorrhages. Selena, I saw your question. I actually screenshotted it and I was ready with it. So I will talk about this because this is one that I also get a lot of questions about, probably deserves its own video, but for now. Selena says, I asked in the IG poll, but in case you can't get to it, can you talk about subchorionic hemorrhages? I'm 9 weeks and was just informed that I have one and I don't understand what this means. Okay, first of all, I'm sorry that you don't understand what this means. It is your care team's job to help you understand. I think a lot of, I'm totally taking a detour here, but like bear with it, I will get to it. But I think grand picture here, the fact that we are walking away from any kind of hospital scenario, doctor scenario, not understanding what's happening happens, okay? Not the ideal situation, right? So here's the deal. If you have questions or you don't know what questions to ask, this is where I'm going to send you to my patient rights video. I said it's the most important video I've ever made. It truly is, okay? It's not like the fun move with your body stuff, but that to me is the best, biggest lesson I can leave with you. It is what I teach through all of my childbirth classes. It's partially what's brewing in my mind for this new whole childbirth curriculum that's coming. I say that now publicly to sort of hold myself accountable because there's a lot in me. If you've been around for a while, you know this. So anyway, with that, a subchorionic hemorrhage is where I need my placenta. Hold on. I should have had my props ready. All right. So you have your placenta, and this is blood flow to your baby. All right. Baby's on the inside of this. Your placenta right now at 9 weeks is much tinier than this, okay? This is like a full-term placenta. This is all the blood flow back and forth. Now, you have an amniotic sac with a chorion and an amnion, right? What happens is under this layer in here, the placenta is all the blood flow, okay? So many big juicy blood vessels that are giving all the nutrients, oxygen, everything your baby needs to your baby through placenta into cord. That's how baby gets oxygen as well. People ask all the time, like, how does baby breathe? And it's here, you're doing it. Through into your bloodstream, through the placenta, filters it out, etc. At 9 weeks, this is usually it's the number one cause of early first trimester bleeding. How many of you had first trimester bleeding? So before 13 weeks, you had some vaginal bleeding. This is a lot of times why. And what happens is there's a little bit of bleeding from the placenta that pools in one little area of behind the chorion. So it's a sub under the chorion, which is a membrane, hemorrhage, bleeding. Okay. Now, most of the time it self-resolves. Can it increase the risk of miscarriage? Yes. This is why they're probably going to put you on pelvic rest. They're probably, which means you're not putting anything in your vagina, no sex, low activity, that you're being careful to sort of like nurture your little placenta as it grows. Now, most of the time, you're going to sort of grow out of it as the other parts of the placenta take over. It's sort of like is self-resolving. And as long as it doesn't keep growing or keep bleeding, that it most of the time is going to amount to nothing, but it means a little bit of bleeding. So we're being extra careful to watch the pregnancy. Okay. I've had a ton of clients, ton of like patients. I had an early bleeding and I was hospitalized for whatever. I came in at this many weeks and they were watching the subchorionic hemorrhage, or I have that still in my pregnancy, and they come in for their labor and it amounts to very little. Okay. All right. Can you lose weight while pregnant? Not ideally, but you can. You shouldn't be trying to lose weight. So there's a difference between like a first trimester, you have what's called hyperemesis of pregnancy, or you're throwing up a lot, you're maybe not being able to eat or tolerate a lot of foods, and you lose some weight. Totally fine. So fun fact, your baby, let me reverse that. Your body is going to always prioritize the baby versus your health, not necessarily your health, I'll say your weight gain prior. So if I eat something and I don't have enough calories to sustain myself, but I have enough to feed the baby gets the food, and I may lose some weight because my body's like, well, now I don't have energy to burn for life. And so that's where some weight loss may happen. Okay. But a lot of times, even in that case, baby's fine. All right. Again, this is where, like, massive disclaimer, as always, you're checking with your provider, but we are not dieting during pregnancy. We're not trying to lose weight. We're not necessarily limiting, I'm going to say limiting calories. By limiting calories is we need enough calories to sustain, to grow a baby. Like, you're not getting fat, you're pregnant. Okay. Now, do you need all the extra calories in the world? No, you need like a couple hundred extra. Okay. This is like an apple and peanut butter is the difference that you need. That's my favorite snack, by the way. That sounds really good. I'm going to have that later to continue to grow your baby. Okay. All right. I love it. And I love how you guys are sharing your perspective. So I have PCOS and tried getting pregnant for over a year and got pregnant the same month. I lost 15 pounds. So, and this is where too, this goes back to the weight loss question, that if you are overweight and you're having a hard time, that is the first thing that's going to be recommended to do, is to lose some weight. Okay. Oh, you inspired me to become a doula. I have 2 epidural-free Vbac births. It's been so rewarding. Oh, I love you so much. I see you on everything, Shades of Sage. So I love how engaged you are. That's the best. Eating healthy. I love it. All right. So you guys can check out the comment boxes for going back and forth. Stretchers of the tailbone. I'll do a video on stretchers for the tailbone. I love that. All right, I'm looking for a couple more questions, and then I know I've been on here for 38 minutes, but I will pop to Instagram in a second. Y'all are making how to breastfeed, how long to breastfeed the child, as long as you feel comfortable. Basic recommended, new American Academy of Pediatrics, I think, just came out with like a 2-year recommendation. That's great for those of you that feel great about it. But that might be a lot for your lifestyle. So I usually tell people go for 6 months. At 6 months, reevaluate, and you'll know, because you'll be like, oh, I don't really feel like stopping, and my baby's still very interested. You're introducing solids by then, so they're not exclusively breastfed. But again, you're going to have to feel this out. BUNDLEBIRTH Nurses is here. She loves my plant. Thank you. They are thriving on the other side. Okay, I see Diastasis Recti. I'm just checking. All right, bleeding first time. Okay, another good question. Can the bleeding in the first trimester be the placement of the placenta? She says, i.e. anterior, etc. So thank you for bringing that up. Yes, it can if it's a previa. So difference, anterior placenta, I would say unlikely, but again, flex and flow. So where the placenta sticks, all right, usually it's going to be posterior. So it's kind of on the back. Your belly's out here, baby's out here. There is no placenta in the front of you. Sometimes it can be anterior, where it's on the front of your uterus, right? It still isn't down here, all right? But it's on the front. And if it's on the front, that can limit your sensation of the baby's movements. You're like, I'm not feeling as much. That's because the placenta is kind of dulling those sensations. In general, anterior placentas shouldn't bleed. What can bleed is a placenta previa. And somebody mentioned this before. And that's where, if your cervix is here, the placenta is actually between the cervix and baby here. All right. If that's the case, baby cannot go through the placenta into the vagina. This, if it's truly a placenta previa, this does mean a C-section. And this is one of those scenarios where I know a lot of you are trying to avoid a C-section. In this case, a C-section is the biggest blessing on your life because you cannot physiologically have a vaginal birth safely with a placenta previa, okay? Now, sometimes if it's on the side, so say the placenta's here, it's sort of touching, or it's like barely touching, or it's just sort of close. I do have a Instagram thing about this that I can repost if you want, that as the uterus grows, it sort of moves away, right? So it needs to be a certain level away. I had a placenta previa. I love it. I don't love it for you, but Francesca, see, this does happen. And she ended up with a C-section. And that's because, and thank goodness, because you'll bleed too much, okay? So bleeding in the first trimester could mean a placenta previa. Typically, you're not going to see that till the second trimester, but flex and flow, so it could. Diastasis recti, I saw some of that. Some diastasis recti, so what that is in our abs, like imagine if I had six-pack abs, which I don't. We'll work on it. Okay, imagine the line in the middle and then like the chunks of the abs, right? The line in the middle of your abs, as your abdomen grows, regardless of really anything, is going to stretch, right? And as it stretches, it can separate the muscle. That is considered a diastasis recti of this middle muscle. Now, if you lay, you can lay flat and then you can feel how many, you'll feel like a divot. I kind of feel a divot in my belly, but that's like my belly fat. So I'll pretend that when you lift up, if they're separated by a certain number of fingers, it's usually, they measure it by finger breadth. So it's 1 finger, 2 fingers, I can fit between 3, 4, etc. I see a 4 to 5 finger. So that is a significant separation of the muscle. This is where PT is going to be really helpful. Most diastasis rectis will heal on their own. Sometimes it could require surgery unless it's causing a like problem, pain, some other complication. A lot of times I don't see them being fixed that often, but I also, this isn't my specialty to fix diastasis recti. And then there's a bunch of exercise programs that you can do. So, one of them I know my sister does is Expecting and Empowered. That's an amazing online program that you can do. They have stuff for diastasis recti. JUNA, which I think is already in the notes below, has stuff for diastasis. So you can check that out. Okay. Thank you to modern medicine. All right, it is 42 minutes in. What do we want to do? I'm going to go, okay, I screenshotted, and I'm going to do 3 questions for my previous coffee and questions. And then if there's anything else crazy that comes in, then I will maybe go there. I have an hour tops, and then I have a meeting at 11 o'clock. So I'm here with you until then. Thank you all for being here, for real. It just literally means the world. Sometimes, to be honest, this YouTube stuff can feel, and I know I've said this before, but particularly in this season, I'm struggling to stay put. I'm struggling to like keep up. And especially like if people aren't watching, I'm like, well, why would I go through all the work? So the fact that you are all here, that you care, that you pay attention helps. All right. All right. This is cool. I don't think I've answered this question before. Coffee Crazed Parenthood says, I've watched your videos on C-section so far, but could you touch on what to expect if you go into labor before a scheduled C-section? Currently pregnant with number 6 because number 4 was a precipitous labor. Number 5, shoulder dystocia. Oh boy. C-section can't be scheduled till 39 weeks. Okay. So if you have a scheduled case, this is for a breech baby. This is for a repeat C-section, your preference, placenta previa, a lot of other reasons, but those are probably the big ones that come to mind. Okay, if you have a scheduled date and you go into labor prior, you go to the hospital and they will move you to the OR in a pretty quick fashion. Okay, let's say it wasn't available, they're waiting for whoever to be there, the doctor to be available. They can even give you an epidural ahead of time, but you would just be bumped to the front of the line and expected to go right in. So for those of you scheduled C-section cases, the nurse in me is like, once you know you're in labor, if you have any concern that you are, please stop eating because they're going to ideally want you to be what's considered NPO, nothing by mouth, not water, not juice, not food, not coffee, not nothing by mouth for 8 hours prior to surgery. They still will do it. Okay. But best case scenario for the risk of safety, when you have major abdominal surgery, they want nothing in your tummy for less risk of aspiration, which is where you throw up and you breathe in your vomit. Not good for your lungs. Not the best case scenario. Okay, so they will go ahead and just do the C-section in that case. Fun. This is Ivana Dar says, my husband and I are planning on trying to have baby number 2 here soon. Yay, fun. What is there to accept with having an IUD removed and conceiving with having an IUD removed and conceiving afterwards? Okay, so if you have an IUD, newsflash, IUDs are my favorite form of birth control. Everybody has to find their own. Excuse the LA noises outside. Bear with it. We have our gardener or somebody is like mowing. Welcome to my life. So if you have an IUD, IUDs are my favorite form of birth control. I think they're so convenient. You don't have to worry about taking a pill. You barely have a period. If you have cramps, not the copper IUD, but the like Mirena or the Skyla or a hormonal IUD. Who has an IUD? Clearly, I love them. They're great. Okay. But and the cool part with an IUD is you just yank it out. Okay. Not you, your provider yanks it out. And then you, in theory, can get pregnant immediately after. My sister is case in point. She had her IUD pulled. She didn't even have a period and she got pregnant with my niece. So this girl has not had a period for like 100 years because of all of the things that have happened in her life. So I would expect, but especially if you had an IUD for a while, depending on multiple factors, usually they say to wait about 6 months to let your body regulate. If you're over 35, it would be 6 months. 6 months. If you're under 35, for the sake of like family planning stuff, up to a year, it can take for your body to regulate and kind of come back. You want your period to come back and then become regular. And then you sort of can assume that you're ovulating, although you can always track that. And so give it like 6 months to a year, knowing that you can get pregnant immediately afterwards. Okay. So you sort of want to plan that into your family planning. All right. Fun. All right. Okay. This one, Ashley Eveleth. This, I think, is the perfect example of why having an advocate, a doula, help, education, why all of you being here and watching all these videos, doing my childbirth classes, coping with labor classes, sets you up for success. Because, and again, Ashley, I don't know where you're located in the world, so there may be other protocols, different places. I am located in the United States, so I know protocols in the US, and I know pathophysiology. So this is where this question comes in. All right, she says, I had gestational diabetes during my first pregnancy and just got diagnosed again at 26 weeks. The first time around, my team at the hospital told me they needed a fasting blood sugar test from the baby. So they prevented me from breastfeeding on demand. If the problem they are checking for is low blood sugar and the treatment is food, why would I hold back feeding? Is this the typical procedure? I have 2 gestational diabetes videos. This is not the typical procedure. In fact, this makes me very, very concerned. So again, this is where I don't know where you are. Let's just say you're in the United States. This is not normal, okay? If you have gestational diabetes, if you have diabetes type 1 and you're pregnant, ideally, best case scenario is baby comes out, goes skin to skin. That helps regulate blood sugar. This goes for all babies. And in theory, I'm going to say all babies are at risk for low blood sugar. Anybody can have low blood sugar. The ones that are more at risk are going to be particularly a diabetic mother or birthing person. And then the ones that are too really big or really small. Okay, so this is why they're getting a weight. And they're like, if there's any concern, they may need to check a blood sugar because those are going to be at higher risk. Low blood sugar is very serious. Okay, your sugar is too low. It is not sustainable with life. That's how serious it is. Now, that may freak you out. Take a deep breath, not a big deal, because you have medical care there that is watching your baby. Most of the times they're going to have some signs. They're going to be extra shaky. They'll take a blood sugar and then they'll respond accordingly. If they need to, worst case scenario, start an IV, give them IV sugar. Great. That is so much better than a low blood sugar in a baby. All right. It's also why you're keeping them warm, etc. The best case scenario for a gestational diabetic person, baby comes out, goes skin to skin. You feed within the first 30 minutes of life to regulate their blood sugar. You are absolutely right. This baby needs sugar to sustain life. Therefore, that keeps the sugar up. There's no such thing. I've literally never heard of a fasting newborn blood sugar. Okay, so I would give a lot of pushback on that. I would ask some questions to your provider and I would say, this is not what I'm used to. I want to feed. There is no benefit to having a fasting blood sugar when they know you have gestational diabetes. What that means is your baby is at risk for a low blood sugar. Therefore, we must feed. If I have low blood sugar, how do we fix it? I have some food. So that one, when I read it, I was like, ooh, I don't like that. That's no good. So in general, that's what I can say about that. And this is where you're all learning to advocate for yourself. All right. I think I have to be done. Mind you, I will come back because these lives, to be honest, are really easy for me. I love them. They fill my soul. I love seeing all of your names, Christy and LP and Francesca and Shan, Kylene, Michaela, Lindsay, all of you that are here, thank you for being here live. Those of you that are watching later, thank you for sticking around. Before I go, one more thing, make sure you check out Ana Luisa for a gift. I always mention their mama necklace. If you are looking for a mama necklace, there's a lot out there. I have given it multiple times. I've given it to my mom, actually. My mom was on the phone or on FaceTime with me. I was like, oh, you're wearing your mama necklace like my mother. And so it lasts. They're beautiful, high quality pieces for a fraction of the price. They feel heavy. So when you're giving a gift, it's great. There's a promo code down below. They're sustainable, all the cute things. So I am representing Ana Luisa today. So check that out. Thank you all for being here. Make sure you subscribe down below. Thank you for sharing these videos. If you found any of this helpful, if you found any of my previous videos helpful, I love it when you share. That helps me grow and continue to move forward in this YouTube land. Stay tuned on Instagram for more posts and more information over there. That's usually where I do any kind of announcements, giveaways. There's also BUNDLEBIRTH nurses. If you're a nurse, we have the podcast, Happy Hour with BUNDLEBIRTH nurses. LP says, P.S. My water didn't break during this video. Shucks. But it's going to happen so soon. So please keep us posted on what happens with this baby. We are all sending you so much love and contractions to your uterus. Come on, uterus, baby, drop. That's all the vibes I'm sending you today. And then if you have any other future questions for future coffee and questions, you can drop them in the comment box down below. I may come back live because live is really fun to answer your questions that way. It kind of puts me on the spot. And so stay tuned for announcements on that, whatever else you need. And then until next time, you know the spiel. Don't forget to flex and flow, and I will see you soon. Bye.